Welcome all. Welcome to this AimExcellence NRMT question answer discussion and see this Doppler echo image and the condition a 25-year-old executive presented with dyspnea. You heard murmur with stethos. Echo picture is given. Which of the following drug won't relieve this murmur? So if you minutely see this particular video, you can see systolic anterior motion of mitral valve, and also there is a disruption in the flow of the blood from the ventricle to the aorta. So that is leading to dynamic left ventricular outflow tract obstruction, and that actually seen this condition actually seen in a condition known as HOCM, hypertrophic obstructive cardiomyopathy. So from the question we found is 25-year-old pretty young guy presented with a dyspnea, and you have heard a murmur, so there is an obstruction and that is leading to the formation of this murmur. So what is this murmur is? It is generally late systolic murmur. Late systolic murmur, and due to the mitral regurgitation due to the systolic anterior motion of mitral valve, that is leading to this particular murmur. Now there are conditions, there are few important points we should keep in mind while discussing this particular condition, and then after we'll come back and give the answer. First thing, what actually happens in a case of HOCM? Say this is heart, so this is a heart, and say this is intraventricular septum. This is intraventricular septum, but there is a intraventricular septum hypertrophy, which is hypertrophic in comparison to the posterior wall of the ventricle. And here there is aorta. There is aorta, and there are two mitral valves. So as per as the factor that is leading to this condition, we have to remember few things. There is systolic anterior motion of mitral valve, and there is left ventricular outflow tract obstruction. Left ventricular outflow tract obstruction. Now these mitral valve leaflets during the systole is actually opposing to the hypertrophic intraventricular septum, and that is actually causing the block or the disturbance in the flow. The outlet of the blood during the systole of the left ventricle through the aorta is actually getting disrupted, and that is giving rise to late systolic murmur. It is giving rise to late systolic murmur. So we have to remember three factors mainly while talking about this particular condition. One is myocardial contractility, two is ventricular volume, and third is aortic impedance or the afterload. So if the myocardial contractility increase, obviously that is going to increase the obstruction. So that is going to increase the intensity of the murmur. So what the condition is actually increases this myocardial contractility. Remember this mnemonics said, that is sympathomimetic amine, exercise, and digitalis. So these are going to increase the intensity of the murmur, whereas the drug which are actually decreasing this myocardial contractility is actually going to decrease the intensity of the murmur, like beta blocker, which is going to be the drug of choice in the most of the cases. Non-dihydropyridine CCB, calcium channel blockers. They are going to decrease the intensity of the murmur. Now the ventricular volume, if there is more blood in the ventricle, that is actually will disperse these mitral leaflets to get opposed to the hypertrophic interventricular septum, and that is going to relieve this blockage. That is going to decrease the murmur. So what are the conditions? Number 1, the supine position. Number 2, passive leg raise. Number 3, expansion of the blood volume. These are going to decrease the intensity of the murmur. Whereas you remember this mnemonic Vasant. T stand for tachycardia, V for the Valsalva maneuver, S for the sympathomimetic amines, A stand for amyl nitrate, and N stand for nitroglycerin. And this aortic impedance or afterload, the conditions which are actually going to decrease this aortic impedance, that is squatting position, sustained hand grip, and elevation of the arterial pressure by phenylephrine. That is going to decrease, that is going to increase the aortic impedance, so decrease the blockage, and that is going to decrease the murmur. But whereas the condition which are actually going to increase the ventricular volume, like we have said, the supine position, passive leg raising, or expansion of the blood volume, that is going to increase the blood volume, and that is going to decrease the murmur, intensity of the murmur. Now few other important points we can remember, because in upcoming examination that can be important questions from this particular topic. It is seen in the general population the ratio is 1:500. 1:500. Among the first degree relative, at least every third people can develop this condition. This can be your important one-liner. Most common presentation is asymptomatic condition. Asymptomatic. Apart from that, in cases of symptomatic patients, most common symptom is dyspnea. Apart from that, other important symptoms are fatigue or syncope. We already have talked about what are the drugs which can reduce the volume of the ventricular volume should not be used, such as another drug is diuretic. We shouldn't use diuretic in a case of HOCM. There is a familial HOCM too, apart from the idiopathic HOCM. And the familial HOCM, most important gene is cardiac beta myosin heavy chain gene. Familial HOCM, most important is beta myosin heavy chain gene. Apart from the drug that we have already mentioned, like use of beta blocker or non-dihydropyridine CCB, which is acting as a negative inotropic agent too. In cases here, they can develop arrhythmia. To counter that, we can give amiodarone. We have to remember the cardiac murmur doesn't radiate to the neck. This cardiac murmur of late systolic mitral regurgitation does not radiate to the neck. Does not radiate to the neck. That can jolly well come in the examination. So in those cases, in those scenarios, we're just going to recap the whole thing once more. This is seen in 1 in every 500 normal population, one case in every normal 500 population. In first degree relative, it is seen in 1/3 of the people. Its main presentation is asymptomatic, and most common presentation is dyspnea. Like other drugs, we should not use the diuretic too, as it is going to decrease the ventricular volume. The most common gene, there's have a familial presentation too, apart from the idiopathic, and the most common gene is cardiac beta myosin heavy chain gene. It can lead to arrhythmia too, and this arrhythmia is going to be countered by the amiodarone. And in cases this after giving all the treatment, the condition is not relieved, then we can go for the surgical option, that is the myomectomy. And this particular murmur is best heard in the lower left sternum. And in our F2F presentation too, we already have talked the points regarding the extra point, and that is in first degree relatives is all from Harrison based points. These are all from the Harrison itself. So 50% of the first degree relatives, if we do, even if they are asymptomatic, we'll find them showing the signs and symptoms and the features of HOCM even through the after doing the echo. So hope you like this particular presentation. If you find this presentation is informative and helpful to you and can help you in your upcoming examination, we have talked about most things like the crescendo, decrescendo, diamond shaped murmur. These are the important one-liners that can come up in the upcoming examination. We have shared the mnemonics, the techniques to remember them. And regarding the answer of the question itself, here you can easily understand we will be able to give beta blocker as is a drug of choice. Also non-dihydropyridine CCB, as because it is going to decrease the heart rate and also going to act as negative inotropic agent. We can give the phenylephrine as it is going to increase the aortic impedance, and there it is going to decrease the intensity of the murmur, but not nitroglycerin, because nitroglycerin is going to decrease the ventricular volume, that is going to increase the intensity of the murmur. So hope you like this particular presentation. If you like this particular presentation, continue to follow us in the Facebook, Twitter and YouTube. In upcoming days, as because we are busy with many things, we are not going to be able to upload many MCQs or discussions, but after the summer hopefully we'll do that. And if you like this presentation, please let us know. We'll get back, we'll get those all the informations, and we'll feel good if this particular presentation is actually come in your aid. Thank you for being with us, for liking us, and we hope that AimExcellence, the bond with you people and AimExcellence is going to continue in 2019 too. Thank you.